A very good morning and warm welcome to all our viewers. My name is Dipali Sapphire and I welcome you all to We Talk Do You show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Puberty to Menopause is yet another platform created by Human Biologicals Institute where we try to provide expert medical advice and create awareness. Well, it's my pleasure to take this opportunity and share about Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunological Limited, shaping global healthcare by spearheading the One Health initiative. Indian Immunological Limited was established by the Dairy Development Board, National Dairy Development Board (NDDB) 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biological Institute was established in the year 1998 when the Government of India requested Indian Immunologicals Limited to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biological Institute was established at Ooty. This facility is one of its kind in India to have rolled out first vero cell culture rabies vaccine in 2000. Subsequently, Human Biological Institute launched other vaccines, and currently we are the major player in human vaccines. We are the leaders in the anti-rabies vaccine segment and present in around 60 countries. We are three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla. Human Biological Institute has forayed into the market of clinically proven wellness products and infertility ranges of hormones. While coming to our vision, mission, and values, our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' needs. As a market leader, we have taken significant step to reduce the plastic burden by 160 ton per annum, and we are very proud of our green initiative. While coming to our corporate social responsibility, we not just only market products, but we also believe in the corporate social responsibility as well. One is the adoption of government school. Indian Immunological Limited has adopted two government schools in the vicinity of the Karkapatla facility in Hyderabad. Another program is Git Mill program in coordination with National Dairy Development Board, where we provide 1,600 school-going children of Telangana and Tamil Nadu are benefited. Indian Immunological Limited has also donated the oxygen generation plant to the Telangana Institute of Medical Sciences, Gachibowli. You can visit us on our website www.indieimmune.com, and you can also contact us on our toll-free number 1800-313-999977. You can follow us on LinkedIn, YouTube, Facebook, Instagram, and Twitter. You can also go through our unique initiative on fight against rabies on www.fearlessagainstrabies.com, and everything you want to know about women health on www.pubertytomenopause.com. So once again, I welcome all our viewers who have joined us live today. Well, as we come to the topic, which is the importance of hepatitis A vaccine for adults. As we know that hepatitis A virus causes a self-limiting infection to the liver. An acute inflammatory liver disease caused by hepatitis A virus infection from close contact with infected person is highly endemic in Indian subcontinent. Well, to know more about this topic of importance of hepatitis A vaccination for adults, we have an extreme special guest with us today. Please welcome Dr. Ashish Chauhan. Well, it's my pleasure to introduce our esteemed guest today, Dr. Ashish Chauhan. Dr. Chauhan is a highly respected consultant physician and diabetologist with over 2 decades of extensive experience in the medical field. He earned his MBBS from the prestigious Christian Medical College and Hospital in Vellore and went to complete his MD in internal medicine from CMC Ludhiana. Dr. Chauhan has also completed a fellowship in diabetes from CMC Vellore, underscoring his dedication to addressing complex medical conditions. In addition to his impressive academic background, Dr. Chauhan has held various significant positions across India, including his current roles at Apollo Clinic and Apollo Sikandrabad. His career has been marked by a strong focus on both acute and chronic medical care, with a particular emphasis on the geriatric health, chronic infections, and aggressive promotion of adult vaccination. Dr. Chauhan is also a passionate educator, have trained countless medical, paramedical, and nursing students, and currently serves as faculty for CMC Vellore distance learning programs. He has been recognized with numerous awards, including the Vaidya Ceremony and the Indywood Medical Excellence Award, reflecting his outstanding contributions to the field of medicine. Today, Dr. Chauhan joins us to discuss the critical topic of hepatitis A vaccination in adults. With his wealth of knowledge and expertise, we look forward to an enlightening discussion that will provide valuable insights into the prevention and management of this condition. Please join me in welcome Dr. Ashish Chauhan. A very warm welcome, Doctor.
Thank you, Dipali, for those kind words. It was really, really nice to be joining you all for this special program of adult immunization, a very important and the need of the hour, especially as we welcome the monsoon, because along with monsoon, many diseases flow in into our house and workplace. So, congratulations to you for having considering these programs and to Human Biological Institute for planning this out at the right time.
Thank you so much, sir. Doctor, while we start with our discussion for the topic for today, I would request you to please let the viewers know about that what hepatitis A exactly is and how does it affect the liver, and can you give us like the overview of the severity or how common it is, especially in the context of India.
In the words of Stalwart, the three F's have killed the human mankind, if I have to say: the fever, the famine, and the floods. We know about COVID pandemic. There is nothing more which we can talk about it. We know half of the mankind have died because of the malaria, which very less people talk about it. We like to focus more into the corporate pushed, heart attack and paralysis and other stuff. But yes, infections are the number one killers in our society. So when we say fever, famine, and floods, now fever is brought by the floods, and hepatitis A is one of those kind of it, which is important for all of us to understand that yes, the statistics are important. Apparently, 1.5 million people get this disease and infection every year. Dipali, you'll be shocked that every day almost 4,000 people around the globe get infected, and that counts for 171 people becoming positive with hepatitis A infection every hour. Thankfully, by the grace of God, it is the morbidity. That means morbidity is sounding that high, but mortality is very less. That means people dying from this disease by the grace of God is very, very less, but it is not zero. That's important thing to understand. So if you get this infection, hopefully not, then with the background of you having alcoholic liver disease, or you having a diabetes or HIV or cancer, your chances of becoming sick and reaching ICU is very, very high. So hepatitis A is one of the infections which many viruses affects the liver. I would go through the definition because we should know what we're talking. I'm
Yes.
talking to, I assume, to the layman. And so hepatitis word is hepar and itis. Hepar means liver. The largest solid organ in the body is liver. And then itis is inflammation. That means I would try to mix up language so that it's easier for all. uh, जिगर की या लिवर, the liver की inflammation या सोजिश या सूजन, So whenever the liver is infected by anything which causing it to get inflamed, we call it as hepatitis. The commonest thing to cause inflammation of liver is alcohol around the globe, and yes, among the infections, it is the hepatotropic viruses. Liver also get inflamed because of other infections like viral or bacterial. Even dengue can cause, malaria can cause, but hepatotropic viruses, hepatitis A, B, C, D, and E. These are the five hepatotropic viruses we commonly talk about it, which affect liver. And in this, the A and E primarily are the feco-oral route. Especially अब जब हमारे यहाँ everywhere we see lot of monsoon arriving, there is
Yes.
a rains which are present. We need to understand, especially I would want the teachers and the mothers and the healthcare providers to understand that their responsibility is high, very high. Not to forget, very very important for the food handlers, for all the people
Yes.
who are running a restaurant or they are in the food industry, managers from all the big hotels. I would suggest that, yeah, they should protect the society by assuring that their own workers, the chef and the people who are handling the food in the kitchen, they all should be taking hepatitis A vaccine, which are of 2 doses. Now, one most important thing I would want to tell you, as I've told you, thankfully, by the grace of God, it doesn't kill. But
Yes.
let me just tell you the gentleman, one person who got this infection. He was a student of 19 years. He came to me in Apollo, and his only condition, the usual way it presents, is weakness. The first few days, today you get infection, the symptoms starts after 2 to 3 weeks or 4 weeks. So a lot of people believe, ki, sir, I went to, for a pilgrimage, or we went for tourism because of summer holidays. But this all symptoms have started from last 3 days, so they cannot connect hepatitis A infection with the travel which they have done last month or somewhere, that time. We all, I mean, say, the weakness I have it, majority of women in India have it, is pani puri. So we
Yes.
all love the street food. अब उस पानी पूरी में पानी कितना साफ है, how good it is, I'm say we will not go into those discussions, but that is where the fecal-oral transmission of hepatitis A occurs, and symptoms come after 4 to 6 weeks. So this boy who I was talking to you about, he started with symptoms of fever, uneasiness, and weakness, extreme lethargy, tiredness, and then maybe some other symptoms like even loose stools and vomiting can rope in, and that is where when the abdominal pain starts, may not. Now, Dipali, you or me, anyone who's watching this program can be having hepatitis A infection, or actually they have it, and they will not know it. They will be absolutely asymptomatic. So another fact which I want to give you, in developing country like that of India, or Southeast Asia, every adult has a serological presence of hepatitis A. What does that mean? That means they already have infection of hepatitis A. Now, is it protecting them or not protecting them? We do not know. What it means is they got infected, and they've had their bout of it. So to make sure that the problem doesn't come in future, we need to make sure that we take a vaccination. Now, but this boy which I'm telling you, who
Yes.
came with fever, weakness, when we admitted him, it's a lot of cases of dengue and typhoid also present with same manifestations. We saw the only complaint was कि sir बहुत कमजोरी है, I cannot walk around, I'm feeling uncomfortable, बस गिरता जा रहा हूँ. And when we check the reports, SGOT, SGPT, the liver enzymes, liver whenever is affected, one of the first things which get affected is liver enzymes, SGOT, SGPT. They should be less than 30 or 35. With 40, we will accept it, but more than 50, we are uncomfortable. And his liver enzymes were 3,500. That means 100 times, the liver was affected. And immediately I said, beta, you need admission, you need rest. The most important thing is you need rest at home. There is no specific treatment. I would want the viewers of Human Biological Institute who are watching this program to understand there is no specific treatment for hepatitis A as such. So prevention is the only answer. So this boy had a whole bout of stay in our hospital for 5 days to 1 week time, where we wanted to rule out other things also. Now, diagnosing a disease is not easy. Dengue presents with same symptoms. Typhoid presents with same symptoms. Even leptospirosis can present with same symptoms, or even flu can present with same symptoms. So there is a overlapping of symptoms. Then we have a people who have multiple infection. They can have a two infection together. Anyhow, we diagnose it to be a hepatitis A. And our experience with hepatitis A is it devastates a gentleman for at least 3 months to 6 months. You feel very weak. There is no treatment available specific. You cannot go for your work. You feel very tired. You are able to fall off. आपको हाथ मतलब कोई you need some support to walk around, and you lose your quality of life for 6 months. And the gentleman who has got this infection, they only know it ki, man, we should not have this infection. So that is what is in a nutshell about hepatitis A. Anybody who is handling animals, anybody who is handling food or the kitchen or the hotel industry or the healthcare providers, and definitely the mothers. साहब आप और मैं बताने के लिए वी कैन स्पीक अ लॉट, बट बच्चों को वो स्ट्रीट फूड से रोकना is a very very tough job. मतलब they'll आजकल with GPay and phone pay around, with UPI they just go and they buy and they
Yes.
eat food. So and to explain it to them कि make sure the water use is a mineral water is very tough. कि सर mineral water से जब हम लोग वो पानी पूरी खाते तो टेस्ट नहीं आता है. So they want the
Yes.
taste, and with the taste comes the all the unnecessary and risky infections. So I urge people to understand the need of vaccination, and it is one of the very time-tested vaccine. And the dose is very simple. It's a zero, the first dose, and second dose is after 2 months to 6 months. We give it after 6 months. It's important to talk about revenue. 6 months of your productive life is gone. You cannot go for the work at least for 3 months for sure. And once you've had the bad course, they know it. So 6 months of your productive life is gone. At least 3 to 4 days of admission, or maybe 1 week of admission, and any bill of around 1 to 1.5 lakhs may come. Even if you do not require admission, I really thank God that you can manage at home also. The liver function test and the tablets and the other things, which definitely drain you out couple of thousands. But vaccine, I'm not sure of the price, what Havisure is all about. But overall, hepatitis A vaccination is lesser than your full body checkup, which you need to do it or whenever the liver is affected. So don't wait, vaccinate is the dictum I want to give it to all the teachers, principals, and healthcare, professionals to understand. And Dipali, especially you and everybody. You know what? The doctors are the worst patients. I'm making this statement responsibly. So I would want everybody in every hospital, even in biological institution, to take vaccine themselves first and protect themselves as well as their family members. That's a few words which I would want to give it to all the blessed viewers who are watching this program.
Thank you so much, doctor, for telling us about this hepatitis A and covering all the information in a very simpler way. And you're very well right. So, almost if we see 89% of individuals are majorly eating outside their homes, and we cannot be sure of how clean it is. And while moving to the next question, doctor, you also mentioned that about the different viral hepatitis forms of viral hepatitis. So I just want to come again to that point since there are different forms of hepatitis. So what are the primary differences between the hepatitis A, hepatitis B, and hepatitis C?
So that's a very good question, Dipali. The hepatitis A and E, E for elephant, so that people understand well. A and E are the ones which are through fecal-oral route transmission. Though in hepatitis A there is some kind of MSM transmission also. We call it as men sex with men, that is homosexual. They also get it, but primarily if you talk in terms of 95% or 99%, it is more of a fecal-oral route. Now, what do we mean by saying the fecal-oral route? Now, if you get infection today, as I've told you, for 1 month, you may not have any symptoms, or otherwise also you may not have any symptoms. Now, during this time, if you are not washing your hands regularly, if you are making food, or if the people like Indians, which we know it, like they're defecating in open outside,
Yes.
now this virus can stay in the surface for a longer time, and this can get mixed with the food, even with the fish and shells. If they're not washed properly, if they're not cooked properly, then through fecal oral route it can get transmitted from the what you and me are eating. It's a slightly resistant as compared to the other viruses. Like, if for compare thing, I'll say HIV, if it is exposed to sunlight once, it is a kind of dead virus. HIV is a very, very weak virus. But hepatitis A and B are slightly powerful viruses. They hang on to the open surfaces for a longer time, and because they survive longer, so then coming to a human body is very high chances. Hepatitis B is very, very infective compared to now B, C, and HIV. These three viruses we talk a lot because we call that as biohazard. Hepatitis B causes cancer. Hepatitis C causes cancer. These and HIV is kind of biohazard, and they all three B, C, and HIV are in the same category. Thankfully, hepatitis A is not into that category. I will just talk about because you have asked for it. B, C, and HIV are spread primarily through the blood transfusion from one person to another person, from mother to the child. It can come from sex, from between two people, heterosexuals or homosexual. It can spread from one person to another person. So whenever there is any fluid which are transmitted, okay, now these three are primarily not the feco oral route. So matlab infected pani peene se you will not get hepatitis B, C, or HIV. This usually is only the hepatitis A which gets transmitted, or hepatitis E. So now there are lots and lots of we call the few F's to be careful is fomites, the towels which you're using it. So if you're not washing it, if you're not sanitizing it, if you're not washing your hands, the fingers, fomites, this is the way which flies, they can spread your infection from one food. If the flies are jumping to another food, then they're in the feet, they can carry the infection, and that time they can come. As I've told you, hepatitis A, E are the fecal-oral route. Along with these two comes typhoid, and other infections which are there of the during the monsoon season. Why am I bringing it out is we need to be relevant to what season we are in, and
Yes.
it's not easy to diagnose for a doctor. So watch out if you have a loose stools and vomiting, if you have a abdominal pain, you have a fever. The couple of infections to be kept in mind is hepatitis A, typhoid, dengue, malaria, and leptospirosis. But yes, if you have a hepatitis, you need to be strictly on bed rest. Rest, rehydration, reassurance. Please get 3R. I mean, so all South Indians love the movie RRR, so they will connect it very well. So rest, even if it is dengue, the treatment is same. Rest and test. R is rehydration. Give lots and lots of water, fruit juice, tea, and coffee. I have a sweet tooth. I love to eat a lot of sweets. But because my mother is a diabetic, my chances of diabetes are high. But only if I get this infection, I'll be very happy to have lots and lots of, sweets. So if you have a fever, if you have a possibility of an infection, rest and test, hydration, drink a lot of water, fruit juice, tea, and coffee. And finally, reassurance. Be reassured, follow your doctor's advice, stay at home. If you have infected, make sure everybody else have taken the vaccine. So now, who should not take the vaccine? The ones who are actively infection. If you got a fever, cough, loose stools, vomiting, या कमजोरी लग रही है, you are feeling कि headache है, please don't take vaccine. It can be dangerous. So vaccine. Lot of people ask me, sir, I am fine. Why should I take vaccine? I said, when you are fine, then only you should take vaccine. So every healthy person who is watching this program, even they should take the vaccine. They should give it to every family member in their body, and understand that every hour 171 people get hepatitis A around the globe. One of the very widespread, irrespective of caste, creed, and religion, irrespective of geographic location. Every continent has hepatitis A infection. Definitely in the developed countries it is less. They kind of take vaccination as a schedule planned by the government, and a lot of governments have given it for free. I think in our side it's not there. I would request the political leaders and bureaucrats to consider. So this is the another flu which doctors get it because of the season. So all need to understand that we are right now the place where I am sitting or you are sitting, Dipali, it's got millions and millions of viruses in the air, flu. So taking the appropriate vaccinations helps out in making sure that you do not get that infection. So hepatitis A is there in every common water source, as well as a flu is there in everywhere in India right now. So taking the flu vaccine and taking the hepatitis A vaccine is very important. Once you get the hepatitis A vaccination, you're kind of saved for whole lifetime. It's the levels of IgM and IgG which kind of determine. And IgM tells us about the recent infection, and IgG tells us about the long time or the old infection and your safety level. So if anybody wants to check, whenever we have a doubt of hepatitis A infection, we tell people to check for the IgM anti-HAV levels, and that helps us out. But yes, we have seen mixed infection, very, very common. My friend Dr. Barani and me, we work together in Apollo hospitals in Sikandrabad, one of the best center to make sure everybody stays out of hospital. And coming to doctor before it is too late is a key, thing which people need to understand. Say, so save yourself, take hepatitis A and hepatitis B vaccine, which is available, and make sure you stay happy, healthy, and smiling always.
Thank you, doctor. As also you mentioned about that this the the worldwide distribution of this virus and almost 1.5 million cases of clinical hepatitis. It's quite a number. And also, very simply, you have elaborated on the types of hepatitis in their differentiation and in terms of transmission and symptoms. The next I want to ask you, doctor, there has numerous outbreaks due to HIV have been reported in India. And also a growing proportion of the population is also no longer exposed in childhood as well. And so what can be the potential health consequences if we ask for adults who contract hepatitis A without the vaccination?
A very high possibility. Rather, I'll tell you one thing. I would want to congratulate IIL for this name puberty to menopause. This is one of the most reproductive age and very responsible age. So puberty is 14 years, menopause is 44, roughly, which we say it out. And this is the person who take care of the society very well. I'm talking about all the ladies in the house. So women need to understand this is the time you cannot, you're 14, 15 years, you're in class 10th and 12th, you're studying for your career, you cannot afford to sit at home and not for 2 to 3 months or 6 months. Number one. 14 to 44 is the time when you're going to the to office every day, you're earning. And nowadays people, it's very, very tough even to miss one day. I would say, look, you need to be on the go, on the toe. That's what the whole thing. So everybody, I cannot afford to with the there was a study which I would want to talk. It came out in newspaper also, especially in Hyderabad, that once there was a raid, I think almost last month, there was a
Yes.
food corporation or the inspectors have made a raid in the food. The big names are there. There is nothing which I need to hide it out. It's in the media platform. So McDonald's and KFCs and all those big which are regularly, the food is kind of changing the hands very fast, and they all did not have the specified, the cleanliness and the hygiene. So they were like, suddenly there was a big outbreak right now. I would want people who are watching this program to go through the net and check it out. Almost 34 big names, Pista House or what all not, Chag House. These are the big names in Hyderabad. I have eaten many times and I'm still in love with those joints. If somebody tells me not to eat it, I find it very, very tough. All those had a lots and lots of unhygienic methods, and the food storage, even expired products were being, the same oil was being used. So I'm not going to go into it, but being a civilized and responsible crowd, we know it, that we need to be a responsible citizen will have a vibrant nation. So you and me need to understand that yes, responsibility starts with you and me. Don't ask not what country has done for you, ask what you have done for the country. So please, asking a government, why aren't you checking it, and all of those are the different points. I'm very much sure our politicians and bureaucrats will take a note of it. But it's your responsibility of every common man, that it is about your family, it's about your own children. So please, the future tsunami which I am seeing is of obesity, childhood obesity with overeating is something which is giving rise to infections and inflammation. I would want all the mothers and teachers to be responsible and spread the right kind of information. Adult immunization is the need of the hour. Everybody should know it, and everybody should take it when it's a right time. When we say adult immunization, do we start thinking in terms of 40, 50, or 60? Answer is no. We start thinking in terms of right now for you. If you're 14, you need vaccination. You need hepatitis A vaccine, you need hepatitis B vaccine, you need HPV vaccination. If you're an old of 35 to 45, again you require all these three vaccines. May not be HPV, and definitely if you're 50 and above, and you by 50 and above, you end up having a diabetes, you end up having heart attack or any other issues, comorbidities. The older you are, the higher is the need for you to take the vaccine, which are approved by the CDC and WHO. Hepatitis A virus affects 15 lakh people globally. Okay, now we are the population of around 1.4 billion. Your and my chances with the kind of food supply which we have it in India, and because of we are a kind of territorial country, and there is a lot of water, and there is a lot of monsoons at this time, you and me can only protect ourselves with the vaccinations, which is primarily hepatitis A, cancer preventing vaccines are hepatitis B and HPV, which everybody should take it. But definitely for all the mothers, vaccines like that of flu and hepatitis A is a must. And definitely now even the typhoid is very much needed. So that importance needs to be understood. And anytime anybody has a doubt, I am very much fine and available at 8106127475, or just reach out to, I think I'm very much sure in our comment section you can write it down. Dipali or me will be very happy to educate you. Even if you are not in Hyderabad, you are in any corner of the world, we will try to connect with you and help you out with the vaccination in your area. So vaccinate, don't wait is the tagline which I want every mother and teacher and a principal to take it along with them.
Thank you so much, doctor. Very well rightly said that vaccination, adult vaccination is currently also the need of the hour. And while going forward to the next question, I want to ask you that since you mentioned about the consequences for adults, so exactly, doctor, who are considered the high risk adults for hepatitis A infection? What can be the criteria?
A very good question you have asked, Pali. Travelers, I think, say I work in healthcare industry and I know it very well. So I have these medical reps who come to me, and every time they're accompanied by their area manager and the other RSMs and national sales managers. So travelers, the frequent travelers, make sure that they should take a vaccine, flu vaccine, hepatitis A vaccine, because you're eating food outside. Say we may be people who are living in metropolitan, and I have already shared the info which is on the public domain, that in metropolitan the cleanliness is not being maintained by the high brands. So your chances of getting infected is high, irrespective you're in 1 star, 3 star, or 5 star hotel or whatever the facility you have it. But then majority of us, we are moving to tier 2 and tier 3 cities because of our business development. And that time, wherever you are, किसी भी ठेला पे खड़े होकर खाना is probably sometime is the only possibilities which we have it at that time. Carrying a sanitizer in the hands to wash your hands before and after with the soap is important. Making sure your hands are clean always is important. And if you are a frequent traveler, you need to take it. Once who are traveling abroad, say if you're going to African countries, there is a lot of outbreak in all these countries. Anybody who is planning to go anywhere abroad, Google, you need to understand, is a very great thing which we have it, our children did, our children have it, but our grandparents did not have it. So just go to the Google and put a word, travel vaccinations for say Nigeria, so travel vaccination for Ghana, then they will tell you what all infection are prevalent there as per the guidelines of CDC and WHO. You can find out. If you are a frequent traveler, you must take a hepatitis A vaccine. If you are a member of an old age home, if you have many people together in military organizations where there is a people who are eating in the mess or who are working in the mess, so the frequent food handlers, if you're a tela wala, if you have got small a shop, I'm telling you, it's not I'm here to incriminate you into it. I'm here to make sure that you do not get a bad name in the social media. Nowadays people are very very frequent in making the social media posts and make words about it. And so to promote your own business, have a very safe practices which is needed. If you are a person who's working in any host hostels, so because hostels have got too many students together eating in the mess, if you're a warden, then you must take it. If you are a mother or a father of a teenage, I sincerely think you should get a vaccine to your child as well as yourself. So almost in a nutshell, I have to say everybody should take it. Say for a second, try to imagine. See, I had a lot of these uh, travelers who are going to United States for their MS program or the post graduation and graduation. Our children go. What is the cost of one semester? Now, answer it is it's almost a couple of lakhs, 8 to 10 lakhs. And what about one of your and my child missing that 8 to 10 lakhs just because he had got a hepatitis A infection because he ate some pani puri or something chaat outside and then he got the infection. So when we have a time tested vaccine, I definitely believe we should not delay in assuring that our children, our food handlers, if you are a president and secretary of a society, make sure that you get these people, the ones who are working in the food handling process, they should take the vaccine. And rather, you must give permission for these people, the food handlers, only if they're certified that they have taken hepatitis A vaccine, there are typhoid vaccine they have taken. Quite a lot of countries around the world, see, like you ideally you cannot drive a bike without helmet. So you should not be working in a food industry if you have not taken a hepatitis A or typhoid vaccine. I'll give you an example of a person called as Mary. Now, this is given in our, we all have our, the Bible of medicine, internal medicine is called as Harrison's. And every medical person will know about this book, the ultimate book to read about the infectious disease. In that, there is a mention of this person called as Mary, and she was finally called as Typhoid Mary. And I think it was in UK that she kind of spread typhoid to everybody for a huge, couple of thousand and lakh people got affected because of her. So one person can spread the infection. COVID got affected and spread just by one person coming from China. So like that, we need to understand and behave responsibly. So if you are a food handler, if you're working in a hotel industry, if you're working in a hospital industry, then you have to make sure that you and your workers and colleagues and seniors, everybody has taken hepatitis A vaccine and you have saved yourself. I hope that communicates the idea and importance of adult vaccination. If you're a diabetic, if you're HIV positive, if you are an old age person more than 50 years of age, if you are a cancer survivor or you're in chemotherapy, talk to your doctor and take a hepatitis A vaccine. If you are an alcoholic, consume alcohol regularly or even on moderation also. If you're a smoker, then you must take hepatitis A vaccine. If you're a fat person, now the obesity is killing and causing cirrhosis, NAFLD and other diseases are there. Obesity is related to many, chronic diseases like heart attack, paralysis, and osteoarthritis. And also, if you're obese person, then also to take many adult vaccination and primarily hepatitis A, flu, and pneumococcal vaccine. I hope this sums up for everybody to understand how important it is to take a vaccine which can save your liver. Say you have two kidneys, if one is damaged, you can survive with another kidney. You only need half of kidney to work. So today, yesterday evening only, I met a person who had one kidney absolutely non-functional and one was normal. I said, no problem, you don't need to worry, your creatinine is normal, you will survive. But with liver, the problem is you have only one. So if liver gets affected, liver does the cleansing of the body. If you're eating anything, especially the oil food, if you're eating anything, the main metabolism of the body is through liver and kidney, and liver being one, you cannot afford to take a risk. So keep your liver healthy, stay responsibly, drink alcohol in moderation, take necessary vaccination, and diet and exercise is the way to keep your liver happy, healthy, and smiling like the way you are. And that's what the take home message I would want to give it to all the viewers of our puberty to menopause, because yes, that age of puberty to menopause is the most powerful, most responsible, and anybody who is between 14 to 44 should understand the importance of adult immunization and adult vaccination.
Thank you so much, doctor. And very true. You have mentioned about that. These are the high risk group where most of the outbreaks occur through them, and especially people who use substances and vaccination. This can only be prevented by vaccination, and vaccination is absolutely very important.
Yeah.
So, doctor, the next question I want to ask you is, whenever a person comes who is diagnosed with hepatitis A, so in hospital, what would be the typical methods which is used for diagnosing the hepatitis A, and how does the condition get managed once diagnosed? And can you also discuss about the available treatment options which is there for hepatitis A?
Definitely. If you have, first, I will talk very quickly about the symptoms. You can be absolutely asymptomatic. And if you come for a regular health checkup, which is needed for all of us to do it at least once in a year minimum, then once you do normal health checkup, you may have a liver function test, LFT, showing some abnormality in the liver enzymes. So liver function tests are 10 different, total bilirubin and direct bilirubin. The SGOT, SGPT, the liver enzymes can be raised few hundreds to few thousands. So whenever the liver enzymes are abnormal, again in the regular health checkup, we'll be doing ultrasound abdomen. So if you have not done it, then we should do the liver function test and the ultrasound abdomen. And if these have been found to be high, then we need to go for the specific investigations. Whenever liver enzymes are elevated, we go for the reason why the liver enzymes are elevated. We will look out for the cause. Like again, we will see is what is the presentation. Hepatitis B and C usually do not cause this much of high of liver enzymes to be elevated. If you have icterus or the jaundice, if your eyes are yellow, if your liver enzymes are high, if you got a fever and weakness, and you got other symptoms like abdominal pain, and when we do the blood specific tests like anti-HAV, IgM or IgG, both will help us out, because hepatitis E also can present with the same thing. So that time we can do the serological testing for the HEV also. But usually, whenever the monsoons are around, primarily hepatitis A affects. And once the report comes, now understand one thing: we do not start the treatment protocol delay waiting for the investigation to come. No, our treatment starts immediately, and sometimes depends a lot on the clinical profile of the patient. If you have abnormal results but you are happy, healthy, your BP sugar is fine, you're not feeling very much, we will say please stay at home. But rest is the primarily thing. Majority of people who make the mistake is they do not listen to the doctors. So if you're taking rest with high liver enzymes, you take the symptomatic treatment. If you have a body pains, taking paracetamol as well as taking the good hydration is enough. Paracetamol itself causes liver damage. So all the medicines, I would not want you to take it through this hearing this conversation of ours, and you start taking your own treatment. That's bad. See, please understand, science, Google, technology, and money. Science, Google, technology, and money. Best servant, bad masters. So please do not follow an advice of a doctor by Google Gyan and start treating yourself. Take a proper consultation to a doctor, either through online or offline. Talk to him, understand your question, the what doctor wants to tell you. Majority of the times, hepatitis A is a self-limiting condition. Taking rest at home, rehydration, making sure that your hydration is enough, and reassurance from a doctor who will tell you about the serial investigations will keep you out of hospital. For the my very blessed audience, I would want to tell you, four eyes will keep you out of hospital. Four eyes, your family for 100 years. You don't want to go to hospital for 100 years, please follow four eyes. Number one eye is information. Right information from the right source. Don't get carried away. There too much of marketing which we do it there, reversal of diabetes and you will never need medicines. Please understand that you need to have the right information. There's nothing called as reversal of diabetes. There is a proper approach to do that. I'm giving you that example so that you understand that over promotion is also bad. Taking the right advice is important. So I is information from the right source, information from the right people, like say Human Biological Institute, I vouch for them, and the Indian Immunological and other people. So information is important, immunization is important. Please take the immunization like hepatitis A, B, HPV, like flu, like pneumococcal, MMR, and meningococcal is important. Please reach out to us at Ethan's Clinic, Garden Towers, Masab Tank, or the best hospital, Apollo Hospital, Sikandrabad. We will help you out, or to anybody who's near to you, who is your family physician is the best doctor. Don't try to say, sir, MD is better or DM is better. No, the doctor who you can trust is the best doctor. So number one is information, number two is immunization, number three is investigation. Any time a doctor suggests any investigations, please don't say, is it needed? If a doctor has suggested, please do it. And finally is insurance. In India, majority of people and the deaths happen only because they have not taken proper insurance cover, and then they avoid admission, and then they end up coming to us in the late stage and they get ICU admission. I have a mission and a vision to keep our hospitals empty, and that I can only do by people like Tipali and the immunologicals who will come with the same vision. You don't want to be admitted scientifically. This is, do not take a word as a Dr. Ashish Chauhan telling. Please go through CDC, WHO. Go your own lensed research. Now, do not do imbalanced one or biased research. Balanced research is important, and your doctor, a good doctor, will suggest you what all needed. So, hepatitis A vaccination, B vaccination, as well as shingles, the influenza vaccine, pneumococcal, and MMR is needed for every elder who is watching this program. I hope that communicates the message. So this is the way the symptomatically we diagnose it with IgM, anti-HAV, and finally we give the rest at home. I have seen people, whenever there is hepatitis infection, what does the liver do? It produces sugars. So if liver is affected, sugars go down. I've had a people who got admitted in ICU because their sugars were low. So if you have a liver affected, please make sure you're doing adequate drinks. ORSL, drink a lot of water, fruit juice, tea, and coffee. Even if you're a diabetic, the only thing is check your sugars at home. If it is on the lower side, make sure your sugars are normal and optimum. And your doctor will help you out in that kind of management. I hope this communicates a message. But if your doctor says that you need admission in ICU, please do not delay. I would want to tell you, my friends, people believe the ICU is for sick patients. The answer is no. ICU is not for sick patients. ICU is meant for making sure patient does not become more sick. It's to prevent a patient from dying. It's a place to prevent people getting more sicker and worsening. 1 day of admission in ICU, 1 day outside, and third day at home is what we follow in my practice. And rather, nobody getting admitted is what is my vision, and that can be only done through four eyes: information, investigations, insurance, as well as immunization is what every viewer of this program I would want to remember.
Yes, thank you. Thank you so much, Doctor. Very rightly said that the information, investigation, and insurance is very, very important, and it covers all. And the doctor, I want to ask you is, as we are talking about the CDC guidelines and WHO guidelines, so does vaccination guidelines differ from the high risk population as compared to the general adult population?
Oh yes, very much. They do differ a lot of it. So the people who are working with animals, I rather congratulate with the human touch which human biologicals have it. I mean, because I know them, and that's what I would want everybody to know. They started with vaccinating, the animals. So there are a lot of and there is a lot of interaction. I have my dog who sleeps with me on the bed, and so there is a lot of transmission can happen. So we have to keep our animals and people around us healthy. So if you are an animal handler, if you're working with you're a veterinarian, if you're working in something like poultry and all, you need to vaccinate yourself. You need to vaccine yourself with the anti-rabies vaccine. You need to take the hepatitis A vaccine. You need to take flu vaccine. Say the first flu, which we always call it, was bird flu, swine flu, and all. It came from the animals. The COVID came through the COVID, through the bats, and there are a lot of these infections happen. So if you are handling any biological product, now everybody who's working in a pharmaceutical industry, I sincerely believe they should take the vaccine. Hepatitis A, influenza, as well as pneumococcal vaccine, they should take it. So there is something called as high risk group, there's something called as low risk group. So if you're an elderly, see, if you have to choose, ideally at this time, I suggest everybody in India should take flu vaccine. Everybody should take hepatitis A vaccine. I'm being I'm telling you out of my experience. I'm telling you out of WHO and CDC guidelines. But if you have to choose, definitely you need to give it more to the high risk people. And food handlers are the high risk people. The travelers, frequent travelers, are the high risk people. Ones who are working in healthcare industry, even if you're a receptionist in hospital, you become a part of the healthcare system. You needn't be a doctor and a physiotherapist or ICU staff only to become the healthcare professional. A receptionist or a medical rep who's frequently visiting a hospital or a clinic is a healthcare worker. So anybody who's making too much of visit to the hospital, they should take their high risk group. Definitely once they are handling water a lot. So somebody, the farmers at this time, they're handling with the paddy. So if their legs are soaked into the water for a longer time, the ones who are in the area where they are handling too much of feces, so somebody who is handling the animal feces a lot, or the human excreta waste, like working in the municipal corporations, they should take. So that's why I would want every responsible bureaucrat who is watching this program, vaccinate your workers. See, human resource is a very important part of your leadership. Investing into them, making sure they have health insurance, making sure that they are immunized, will take your organization to the next level. So work for people. They say if you want results in months, invest in the trees. But if you want results in the decade, even after you are gone, then invest in the people. So please take care of your people in your own organization and get them vaccinated as per the guidelines given in CDC and WHO. As per CDC guidelines and WHO guidelines, food handlers, hospital industry people, old age home people, hostelers, your people who are exposed to the water related issues, like working in the sewerage or sanitation, all of them should take hepatitis A vaccine. 2 doses, IM injections, 0 to 6 months. First dose is very, very important to be taken. And when you are taking these infection injections or the vaccine, you should be healthy. Please do not take it if you have got cough, loose tooth, vomiting, fever, or थोड़ी सी कमजोरी लग रही है. Should I, because my brother got it, so should I take it immediately? If your brother got the infection and आपको भी थोड़ी सी कमजोरी लग रही है, that means you already got the hepatitis A or other infection, and at that time you should not take it. So you should take the immunization when you're healthy and on the advice of your healthcare provider, that is your doctor. So that's what is the message which everybody should understand.
थैंक यू सो मच डॉक्टर. डॉक्टर, मैं आपसे ये पूछना चाहती हूँ कि व्हेन वी सी ओवर टू थर्ड ऑफ इंडियन adults are not aware about their adult vaccination, or they do not know that what all vaccination they have taken in childhood. The vaccination records are not there, and some may also think that vaccines are only for the children. Since we are talking about the hepatitis A, apart from the hepatitis A, what all vaccination, what are the list of vaccination an adult should take?
Yes, a very good question. Yes, two-thirds of our population does not know about adult immunization. You're very, very right. See, I'll tell you what, I have done MD medicine, which is MD medicine, everybody knows. I actually was very much interested in doing community medicine, or psychiatry, because I see that has got a lot of meaning in the society. But in Indian scenario, the community medicine doctors and the psychiatrists are not well respected. Kind of the perception is different. I'm not here to judge anybody, but that's a truth. So I have been a preventive medicine expert. Even after medicine, MD medicine, I see people in ICU, acute medical care, I see. And but my personal attachment and the passion is to keep people healthy, happy, smiling, and keeping out of the hospital. So as a preventive medicine expert, I feel uncomfortable when I hear 47 years old Mr. Amol Kale, he died of the heart attack in while watching the Indo-Pak news. I feel he did not go to the right doctor at the right time. So the people avoiding doctors means they're avoiding the right information. And who will give you the information other than the right kind of doctor? Right now we have as I've told you already, Google is promoting marketed product more, and you and me have to be bothered about our own health. Women especially, I would want to respect all the mothers and sisters who are watching this program. The health and the wealth of the family, my salute to all the Nari Shakti. The health and the wealth of the family is in the hands of the women. A woman can make a family and break a family. We all know it. We have seen all our Saas Bahu ka soaps, and we know that very well. So all the ladies should understand that they themselves as well as their family members should take the vaccinations, the adult vaccination, which primarily is flu vaccine, hepatitis A vaccine, and especially because they are again the food handlers now. घर में खाना कौन बनाता है? When I have been to kitchen, take my words, maybe last week, maybe because my wife ordered, I had to go to kitchen. Otherwise, I will not go to the kitchen. So the food handlers are mothers. So they have to understand first, they have to get themselves vaccinated. And definitely, they have to give vaccine to their own family and the children. So this is what everybody through this they need to understand. Two-third of adults do not know about adult immunization. That's why we are doing this program, and I'm very happy, delighted that how socially relevant we and our approach is. And we should, after this is recorded, I believe this will be on the YouTube link. So
Yes.
once that is there, spreading it to among to everybody else is very, very needed. That's why I'm mingling it with even Hindi also, because I do not want ki hamare the maximally spoken language in India is Hindi. So they also should understand. I would want somebody to add even subtitles also, so that the ones who cannot hear also get the right message. So if you're an adult, be a civilized and responsible adult. Voting for your leaders is your responsibility. Taking care of your family with right kind of insurance and immunization and information is your responsibility. Making this great nation more great and a greater is your responsibility, and I am there to help you out from the healthcare industry. I'm very much sure people like us are there to help you out with the right information every time.
Thank you so much, Doctor. Doctor previously also mentioned that even now that outbreaks due to foodborne hepatitis A virus is have been frequently reported in India, and if we see our culture, especially with the adolescents and adults, we do have a culture of eating and socializing at street food stalls, attending wedding or maybe any other social gatherings. So still, I would ask that why still India, in among the nations with high hepatitis cases?
You've asked a very great question. See, sometimes it's become very, very tough to answer a few questions, but I would like to answer this. Is um, हम लोग वी इंडियंस दे वी लव टू गेट कैरिड अवे बाय आवर दिल, हम लोग अपने
Yes.
दिल की बात ज्यादा सुनते हैं. सो वी रादर आई हैव बीन टू यूनाइटेड स्टेट्स 3 times, and take my words, I realize कि I'll never want to go back again. It's a very good developed country. I have nothing personal against it, but I realize कि people interaction is very, very limited. अगर उनको आपसे काम है, then they will talk to you. If there is no work, they don't like to talk to you. In India, people meet, mingle a lot. and these things usually happen in the big functions, weddings or any birthday parties, and or maybe on the street food also. It's a big joint. Barish ho jaye and everybody will run for a pakoda and chai. Everybody knows that.
True.
And then बहुत ज्यादा गर्मी हो रही है या अदरवाइज ऑल्सो थोड़ी सा मौसम अच्छा सा है, तो पानी पूरी के आसपास भीड़ लग जाती है. तो वी नीड टू अंडरस्टैंड कि दैट्स हाउ वी आर मेड. And that's why I would want ki people like human biologicals and the pharmaceutical industry should advertise about these vaccines more places where the food eateries are there. So it is about making sure that we do the right thing at the right time in the right place. So I would want to urge the politicians and the bureaucrats. Say, Sahab, one of the very beautiful movie made was Jawan, I think, by Shah Rukh Khan, which was very socially relevant. So yes, the policy makers have to understand this. Say it is not about, it's about understanding that the responsibility which we are shouldering on our selves, and taking care of our society is our responsibility. And we have to, whatever we are, whether we are a peon in a office, तो वो जो हम लोग पानी लेकर के आते हैं ना, लाइक आई हैव सीन इन यूपी एंड बिहार, ग्लास के अंदर वो उंगली डाल करके पानी लेकर के आते हैं. Those things we have to subtly tell them, beta, this is not a right thing to do it. Don't need to criticize it. We have to change our the way we have been working. Then washing hands before and after having food, or even before and after going to toilet. So these all habits are very important. And then promoting vaccination is very important. See, I'll tell you, both the things go hand in hand. When I talk about, cancer is getting spread very fast in India. Okay, what is the difference between US and in India, or the Western country in India? In India, we catch cancer in the last stage. In US, we catch it at the early stage. They have more information. So this information should, this kind of right information related to health matters should go to the general public. Say, we want you to stay out of hospital, immunize, inform, talk about yourself. If you are into habit of street food, our children are, so getting the vaccine, one jab doesn't pain at all. In the hands of the good vaccinologists, you will be able to get one single shot and it is absolutely fine. Say, rabies kills almost 100 Indians per hour, and that is scary part of it. So taking the rabies vaccine is very much needed, and that is for everybody. So knowing it, ki what we are, what our threats are, and then working against those threats are important. So every mother, every responsible father should know, every responsible teacher and principal should talk about it and get vaccinated themselves, as well as their peer group who they hang around with. Every club, like Lions Club, Rotary Group, I should want to urge, they should make organize talks like this. I'll be very happy to come or organize a webinars like this. So spreading a word is important. See, working on the ground level is very much needed. Spreading the right kind of information at the right time, to consistent basis, is very much needed. So 2/3 do not know about adult immunization. So we have to reach out to them through these kind of programs and make them know, "Ki, look, you need to live for 100 years. One of the biggest thing which kills Indians are the stress. One of the biggest thing which kills Indians are the sedentary lifestyle. Stress, sedentary lifestyles, along with safety measures like taking vaccination, is very important, and people should understand that."
Yes, thank you so much, Doctor. Doctor, this question I want to ask you is, हमारे इंडिया में there is a serious concern for vaccine hesitancy. बहुत सारे लोग वैक्सीन लेना नहीं चाहते, उनके अलग ख्याल है इस चीज़ के लिए, या तो वो ऐसा सोचते हैं कि अरे साइड इफेक्ट होगा, अरे बाकियों को वैक्सीन ले लेने दीजिए फिर हम वैक्सीन लेंगे, या वैक्सीन तो काम नहीं करती है, या दे डोंट बिलीव इन वैक्सीन. So, in your practice, doctor, what can you, what do you feel that what could be the main reasons for vaccine hesitancy among adults?
You have asked me a very tough and very good question. I congratulate you for having thought that, and especially with the COVID vaccine and the controversy with COVID vaccination, this question does come, and no doubt about it. And at a personal forum, at personal front, probably I will be siding with them. I am not here to say anything. I wish there was something called as black and white. ये ले लो ठीक हो जाएगा, but majority of life is what I have, my looks, it's a salt and pepper, it's gray zone which matters primarily. So yes, take a informed consent and take the vaccine. I will tell you a few words which I follow myself. all the vaccines, the longer it exists in the market, the better they are, the better safety profile they have it. So I have been a strong promoter of hepatitis A and hepatitis B, flu, MMR from ages more than 20. So hepatitis A vaccine has been there from the ages. It's not something new, but I'm very happy that it needs to be talked more about it. Whether it's a heavy sure or is it Biovac A, but you need to go with what is the local brand, because it's been tested on the local Indians. So that's what you need to go for it. And having a vaccine hesitancy, you need to talk to your doctor. You need to openly ask him. You need to ask him one question: have you taken it? Have you given to your parents? Have you given to your children? If the answer is yes, you don't have to think twice about it. But medical science is very, very tough. Just by Googling by yourself, Google will show you what you want to see. Google will not show you the unbiased opinion. Google, if you want to find out the cancers caused by vaccines, no, almost there are none, but it will somehow find you the rarest way to have it. See, I am always scared the time I get into the plane. But what is the chance of air crash? One in 8 millions. Okay, the chances of you and me having an accident while we're walking on the ground on the road is much much more than having a deaths by the airplanes. But we get scared. So yes, having your own doubts and scare is right. It's a human behavior. But talking to your doctor and giving the right kind of treatment is needed. You should not take hepatitis A vaccine or any vaccine for that matter if you are pregnant without consulting your doctor. We definitely suggest a flu vaccine to pregnant women as well as DTaP or Boostrix. One of those things can be taken. That is fine. But hepatitis A vaccine, I'll not suggest to the pregnant women unless and until your doctor suggests for some reason or the other. And you can ask him why is he suggesting. There is no doubt. But pregnancy, we need to be responsible and take the vaccine which doctor suggests. Otherwise, no. So you need to understand and take a right kind of call for your own family. At the end of it, you for there is a big world where people have it, but for few, you are the only world they have it. So you need to take a vaccine which is responsibly time tested, and people have used it over the decade and all. And hepatitis A has been in the market for a pretty long time. It's not a new vaccine. We're talking new, but it's been there in the market for a very, very long time. The first vaccine to prevent cancer was hepatitis B, and among the hepatitis series, only hepatitis A and B vaccine are available. Sometimes it is available in combination also, where hepatitis A and B can be taken together. If you have not taken it, I sincerely believe anybody who's watching this program should take hepatitis A and B today. That's what my take home message will be for everybody.
Thank you, doctor. Doctor, now there is pre-exposure prophylaxis and post-exposure prophylaxis. So I want to ask you this: under what circumstances should post-exposure prophylaxis be administered for hepatitis A?
Okay, post-exposure prophylaxis, I'll understand this term which you usually use it for rabies. For hepatitis A, we will see कि one of your family member has got it. So probably आप सबने वहीं एक ही जगह पे खाना खाया होगा, तो your chances are also high. I would not mind giving you a hepatitis A vaccination if you do not have any symptoms at all. But if you've got a loose stools, vomiting, you're feeling uneasy yourself, you're having a kind of some fever, I would not suggest you vaccination at that time. That means you probably already got an infection and your body is already producing antibodies. So suppose if five people have drank the same water, which probably is hepatitis A positive and carrying the virus, then maybe one gets infected, other four do not, other four will be developing their own immunity. Now, how safe the immunity level will be, we do not know. But when somebody has got exposure, post exposure, suggest the vaccine only and only if he is healthy, does not have any symptoms at all. Otherwise, wait and watch and take it after 6 weeks to 8 weeks when all the symptoms have gone is the best thing. So pre-exposure, post-exposure, the best way to remember is pre-exposure is better, superior. So that means you and me right now, we should take the vaccine if we have not got exposed to it. But if we've got exposed, we need to watch out. There should not be any symptoms at all. No fever, no loose stools, no abdominal pain, no cough और नो गिडीनेस. सर मेरे को थोड़ा सा चक्कर आ रहा है, वैक्सीन ले सकता हूँ ना? No, take it. If you have got chakkar, take a doctor's advice. Doctor is your own doctor will know why you are having a chakkar, why you have got other problems, and he will tell you whether you should take it or not. So only and only by your healthcare professional advice only, I would suggest you should take the vaccine.
Thank you, doctor. Doctor, is there any advantage and a disadvantage of using vaccination versus immunoglobulin?
Immunoglobulin is kind of active immunization. So what you need to understand it is key. Immunoglobulins is you're already caught in. We give it in rabies. It's easy to understand. So if you haven't got the dog bite, then we give pre-exposure vaccination. That is a normal vaccine, the rabies vaccine. Now, once you get infected, you got a dog bite. After that, there is again two things. We have to give rabies vaccine, that is rabi vax or rabi is what is there. The different brand names are there. I'm just making comfortable for people to understand. And active immunization we give it because probably the virus is already there in the bite site. So we have to give immunoglobulins, which we give it at the site, the local site. We give the injection. Immunoglobulins, personally, I do not like it. I do not give it. I suggest only a clinical decision to be taken. Say, making sure enemies don't enter our country or our state or our house is better than killing them while they are inside our house. So do you get the point? So immunoglobulins means once they have entered your house, you are killing the infiltrators, and immunization, the vaccination means making sure they do not enter our house at all, or at least not with the armamentarium or not with ammunition. So when we give the vaccination, we give subclinical infection to the body where they enter our house or our country, and that sensitizes our own immunity to fight back and produce more immunoglobulins. So if immunoglobulins are enough in your body, you will not get infected, and that's what we are trying to do it. So vaccination is much more superior than the immunoglobulins, but follow your doctor's advice. तीन लोगों की एडवाइस आपको कभी भी मिस नहीं करनी चाहिए. ठीक है, डेफिनेटली चार लोग बोल दूंगा. बॉस, बीवी, वैद्य, भगवान. That's on the lighter note, but that makes a lot of sense. All four of them will always talk about good about you. They may be harsh, they may not be sounding good. So Baidya, boss, BV, Bhagwan, and all of us need to understand the right advice. I hope that communicates the right message.
Yes, perfectly well, Doctor. Doctor, there's one question I want to again ask you, though you have covered about the travelers' vaccination. So when we take the statistical data by the UN World Tourism Organization, they say that around 50 million Indian travels overseas every year. So then it again comes to the travelers vaccination. So doctor, what according to you are the hepatitis A vaccine recommendation for adults traveling to high risk areas?
A very good question and meaningful for everybody to understand. If you are traveling out of India, forget about that. Even if you're traveling within India, you must take hepatitis A vaccine, flu vaccine. These two vaccines I will strongly recommend. Why? Because you're breathing in the, say, जिंदा रहने के लिए सांस लेनी है और पानी पीना है. So you cannot afford to. No, you do not know what water supply which you're getting it wherever you are. Okay, so just because it is being supplied in any particular bottle, again you can't be sure because you're not sure whether it's the same water or is it somebody has recapped it. So if you are a traveler, frequent traveler, if anybody who's coming from abroad to India, like foreigners, I would want them also to take hepatitis A vaccine. And it is only, the best thing is only two doses, one right now, one after 6 months, and the first one helps the maximum. So suppose if you travel after 1 month or 2 months, taking a hepatitis A vaccine is very much needed, and there's no double thoughts about it. So if this is the right message, if it goes to those 50 million travelers, I think my whole desire to do this whole program will be successful, because yes, every traveler should take a travel vaccination, and the number one vaccine they should consider is flu and hepatitis A, as well as typhoid, because yes, this is what is in your water which you are drinking, and safety of water is not very easy to assure, especially if you are on the receiving end, because पानी नहीं मिल रहा तो जैसा भी मिलेगा you will drink it. And especially now, just now we are still, the North India has got a very bad summers. So with high heat, whatever say micro level of pollution or adulteration, you will not know. आपको साफ पानी लिख रहा है, you are drinking it, but that water can be full of virus and bacteria, and that can definitely make you serious, and I wouldn't want you to do that. So travel vaccination, the first vaccine to consider is a flu. Second, along with flu too, is hepatitis A vaccine.
Well, thank you so much, doctor. Uh, Thank you for answering all the questions, and we have got and the session is going so well, Doctor, that we are getting lots of audience engagement as well, and we're getting lots of questions. So there are some internal questions that I have received from the audience.
Yes, please.
So the first question is, are there any? He's asking, Doctor, are there any side effects associated with hepatitis A vaccine?
I'll be very candid in giving that answer. साहब साइड इफेक्ट तो मैरिज के भी होते हैं, लेकिन फिर भी वी गेट मैरिड. So there is, if somebody says, because I know in the global platform, आयुर्वेदा के कोई साइड इफेक्ट नहीं है, होम्योपैथ के कोई साइड इफेक्ट नहीं है, that's highly impossible. uh, if some drug or a food does not have a side effect, that means they will not even have an effect. To have an effect in the body, you will have a side effect. That's number one. Okay. So if somebody says for anything iska koi side effect nahi, that means that person is either does not have enough knowledge, or that person is fooling you. Okay, sir. So if you need to understand, every vaccination has a side effect. They're very, very minimal for the ones who are time tested. Okay, for time being, because obviously I would want to have a balanced, reasonable, correct information given to you. I'm not here to make a diplomatic statement. I want to talk about hepatitis A vaccination. I will want to talk about flu vaccination. I will take it. I've already taken it. This is what I will give it. I'll give it to everyone in my family as well as outside. um I have a reservation. I may have a reservation about few vaccines, the recent vaccines. Time tested, no. Okay, so the ones who have been in the I don't like the word market. I will say the time the vaccines which have been in the ecosystem for more than a decade, you don't have to think twice. So flu, pneumococcal, MMR, hepatitis A, hepatitis B, shingles, yes, don't worry about it, go for it. And these all have been done the phase 1, phase 2, phase 3 trials. I hope that communicates how safe these vaccines are. How unsafe, or what is the thing which you need to understand, because the day you get vaccine, make sure you're healthy. You should not have a fever, cough, loose stool, vomiting, and under some pressure you take the vaccine. Kal flight hai, aaj aap aake vaccine le le, nahi. Please take vaccine when you're healthy, you don't have any symptom at all, take the vaccine. Okay. Third thing is, after vaccine, 2 days to 3 days your body is producing immunoglobulins. So that time you will get a fever. After taking vaccine, if you get a fever, thank God, that means vaccine is working. After getting a vaccine, if you get fever, thank God that vaccine is working. And paracetamol is simple tablet, you can take it, or rest, you should take rest. I usually tell in my practice, if you have taken a vaccine today from me, I'll say 2 days, no chicken, mutton, no smoking alcohol, no gym exercise. When I say chicken, mutton, I mean spicy food. For 2 days, you should not take too much of uncomfortable food and all. No smoking alcohol. Definitely, smoking alcohol directly affects your immunity and as well as your body response to any vaccine generation, or the IG immunoglobulin generation. And no gym exercise. You should not take vaccine and go for gymming. No, your body takes time. There is a biochemical reaction happening to the body. You can't afford to take vaccine and you can go for the running and gymming. No, not at all. So when you are responsible citizen, when you're responsible audience, like the way you're watching this thing, you will pass this message, and you will not bypass. Say, Abhi, I'm not very happy to say, Garba ke samay, just few months back, 10 people died. They got heart attack while they were dancing in the Garba in Gujarat somewhere. I think it's in the net. You can check it out. So when you are not well, you should sit at home. When you have taken a vaccine, you should sit at home. You need to understand that everything. Say, suppose for our safety, few of us may have a licensed guns at our home. So we have to be responsible. We can't give it to our children. So like that, when you're taking vaccine, you need to be responsible. Every vaccine, what are the side effects? You will have a local pain in the arm. You've taken an arm, it will have a local reddish sign, which is good for you. Local pain, which is good for you. For 1 or 2 days, you may have some mild fever, good for you. Okay. And rarest, very, very rarest, you can get GB syndrome and stuff like this, but they're very, very rare. with the hepatitis A and the other vaccine which we are saying. We are telling it because it is our duty to tell us one in a million will have some kind of side effects. One in a trillion can even die also because of vaccine. But that's what I'm trying to say. Please get my words clear cut. If you're scared of dying, then you cannot come out of the house also, and even house also, your chances of getting the infection and death is very high. 1 in 200 pedestrians जो वर्क प्लेस पे जाएंगे दे डाई ऑफ द रोड ट्रैफिक एक्सीडेंट, तब फिर आप रोड में निकलना भी भूल सकते हो. So this is the way, and you have to understand the analogy very, very well. And you have to take the vaccine. We all take the vaccine, and we all supposed to and should be taking the vaccine. I hope that communicates the right message for your viewers, Dipali.
Yes, doctor, absolutely. Thank you for answering this question. The another question I've got is, can hepatitis A infection reoccur after recovery?
Oh yes, there is a possibility. So short possibilities are there. अगर गंदा पानी पीते रहेंगे वही अगेन एंड अगेन, hepatitis A infection also gives the immunity to you, no doubt about it. It's like chicken pox. Ideally a chicken pox अगर एक बार आपको हो गया varicella, then next chance होने का बहुत रेयर हो जाता है, but ऐसा नहीं होता कि we haven't seen it. Okay, so there are always a possibility of reinfection, and that's the reason we suggest that you should take a vaccine to protect yourself from the reinfection possibilities. So these are the re-strengthening or uh, giving the immunoboosters kind of thing which are needed. So rather in my clinic somebody says कि sir कोई ताकत का injection लगा दीजिए, I do not mind giving them the vaccination after knowing that they trust me a lot, and I say कि one of the good immune boosters are taking the right kind of vaccination. So yes, reinfection के chances होते हैं. इसीलिए किसी को इन्फेक्शन हो गया को भी मैं वैक्सीनेशन के लिए बोलता हूँ. मे बी आफ्टर 6 months to 1 year is what I will say. I will change depending in terms of clinical profile of the patient. No, one size fits all is not the thing. It is the clinical profile of Dipali will be different, Dr. Ashish will be different, my children will be different, of elderly patient will be different. Which background do I come from? For African patient, it will be different. For the rich patients, it will be different. So there are the clinical profile which we need to see. I hope that communicates the right message.
Yes, thank you, doctor. There's one question asking, sir, if a person is suffering from hepatitis B, that person can take hepatitis A vaccine as well?
Oh yes, they should take it rather. It's very simple. आपका liver है. आप दारू पीते हो, आपका liver is slightly, what you call, diseased. ठीक है, अगर हेपेटाइटिस बी है, योर लिवर इज डिजीज्ड. सो वेन एवर यू हैव इट, you don't want two attacks from two different sides. Say I am very, very crystal clear. If you're in Kashmir, you have chances of attack from Pakistan, from China, from local also. So जिससे भी you can protect yourself, you should protect yourself. If you're hepatitis B positive, please take hepatitis A vaccination. If you've got a cirrhosis, that is end stage liver disease, you must take hepatitis A infection vaccination, as well as other vaccinations to save your liver furthermore from any future possible insults which can come to you. So if you have hepatitis B positive, or if you're hepatitis C positive, you must take hepatitis A vaccination.
Thank you, doctor. There's another question asking, before hepatitis A vaccination, is it required or recommended for LFT, as hepatitis A infection is mostly asymptomatic?
I did not get it. If a patient is asymptomatic, then to take vaccination is very much needed. If you have a doubt that you're already infected, then you should not take it at that particular time. ठीक है, LFT abnormality है, that means you have some issues. Talk to your doctor before you go for a vaccination. So please understand few words from me, my dear audience, and note it down. Tell it to your teacher, tell it to your principal, tell it to your friends, as well as your apartments. Go to a doctor when you do not need him. Go to your doctor when you do not need him, and you will never need him. So if you are healthy, come to me. I will make sure you remain healthy for lifetime. Vaccinations need to be taken in the right way, right time, by the right doctor. If you're pregnant, you can't take hepatitis A vaccine. So you need to understand. So please don't get carried away by the discussions. So if you have a hepatitis A patient at your home and you're pregnant, should you take or not? I think that's what your doctor will decide for you. Okay, how many vaccine we can take together? 4 vaccine we can take together. 2 in the deltoids, as well as 2 in the gluteus we can take it. 4 different vaccines can be taken, like MMR, flu, hepatitis A and hepatitis B or meningococcal. So this is another thing which I wanted to tell. We usually do not combine two vaccines with COVID. COVID vaccine has come very, very recently. So if you're taking COVID, then I will not suggest you to take hepatitis A together. I hope you get the right message. Do not take any vaccine along with COVID simultaneously. At least you should give a vaccine the gap of 2 weeks. I hope you get what I'm trying to say.
Yes, thank you so much, doctor. There's another question that asking that, sir, how he's saying, sir, very informative session, sir. Sir, how
Thank you.
informative is to give hepatitis A vaccine after 49 years of age?
Oh, very much. 49 years of age, lena chahiye, no doubt about it. And because sir, our indulgences are, say, I am a doctor. Sometimes people say, sir, आप खुद डॉक्टर हो, खुद आप you are getting indulged into it. Street food. See, I'm very unhappy or whatever, excited to share this. My mother is a teacher. So one 5 years old girl came and she asked this question, टीचर बाहर का खाना नहीं खाना चाहिए ना, तो मैं टीचर से इमीडिएटली हाँ बिल्कुल नहीं खाना चाहिए, एंड इमीडिएटली शी सेज कल मैंने आपको देखा था आप चाट खा रहे थे. So we teachers or doctors, we all are humans, and so you may end up seeing me also having street food. So because street food is so much common in our ecosystem, in our environment, the protecting ourselves beforehand is the only answer. So you must get vaccinated and save yourself. And definitely, if you're age of 49, say at this time, amazingly, 35 to 55 are more at risk for various many things. I told you the name of Amol Kale, who died during watching the USA and India match. Then I very well remember my very beloved singer, Mr. KK, who died with a heart attack. So heart attacks are very much growing, and that's because we are not, or we are avoiding doctors. So please go to a doctor when you do not need him, and you will never need him. And doctors can save you with the medicines and the vaccinations if you are taken in the right way at the right time. And substituting doctor with Google knowledge, strictly no. If you're going to say, ki, sir, I follow Dr. Ashish Chauhan's advice after watching puberty to menopause without consulting doctor, I will not be very happy. You must connect with the doctor. आपकी एंड भगवान ना करे आपकी मौत के बीच में एक ही बंदा खड़ा होता है, वो है आपका डॉक्टर. एंड यस, आपके वेल विशर्स की दुआएं. तो हर किसी की दुआएं लेते रहिए, अच्छी बातें फैलाइए, अच्छी इंफॉर्मेशन को स्प्रेड करिए, एंड हर समय अच्छा सोचिए. आई एम वेरी मच श्योर आप ना सिर्फ एक अच्छे इंसान बनेंगे, you will be a very good citizen for our blessed country. I hope you get the message. Take care.
Thank you so much, doctor. Doctor, there's another question. He's asking several dialysis centers are more concerned for hepatitis B and C, not A.
Okay, there is no vaccine for hepatitis C right now. We only have for hepatitis B and hepatitis A. That's one thing. Hepatitis B, if goes out of the hands, it kills. Hepatitis B can cause cancer, and it's a blood related. So dialysis center will always will call hepatitis B because you will be using the machine. You will be infecting the machine as well as yourself. It's a mutual safety. So hepatitis B definitely is needed. If you're going to ask me which is the safe, which one should I prefer, if you're a kidney failure patient, I will always say hepatitis B. There is no doubt about it. Please don't get say we are doing this program to give you awareness about hepatitis A, but that does not mean कि सर हम लोग दूसरों को undermine it. If you are a patient who's got a kidney failure, you should first vaccine you should take it is hepatitis B, and then you must consider hepatitis A. So they would want to keep if you have to choose between two. For a dialysis patients, hepatitis B is very much needed. But I'll say don't choose between two. Take both. You need to have it. And I'm very much sure. I do not know if somebody from HBI is watching this. Do we have the combined vaccine available? If we do not have it, we must plan to manufacture one and take both the vaccines. As my dictum to you will be.
Yes, thank you so much, doctor. There's another question asking how long does it take for hepatitis A symptoms to appear after exposure?
Almost 2-3 weeks till 6 weeks. So अगर आपने कहीं पे बाहर स्ट्रीट फूड खा लिया, आपने पानी पूरी पी ली, तो you may have the symptoms after 1 month. So suppose if you have traveled to a different state, I am a hardcore food lover. I go to UP, I cannot avoid having the chart and all. I will have the symptoms after coming back. Then the worst thing is patients forget to give the relevant history to the doctors. They forget to, sir, वो तो 1 month पहले गया था. Why should I tell this to doctor? So they say, sir, we have got a vomiting sensation, nausea, and fever from last 2 days, 3 days. So they don't understand what they have done. So symptoms take longer time to develop, and then it definitely causes death in the rare occasions. Hepatitis A infection can cause severe hypoglycemia as well as hypotension, and I've had a patient who've been admitted in ICU with low BP and low sugar, and they were almost on the verge of losing them, but we made them survive, and we thank God for their approaching to the doctor right time. So staying away from doctor usually kills. So one of the strong reasons we have people getting heart attack, paralysis, kidney failure, and dying suddenly is because they doubted their doctor or they reached out to the facility very late. So please remember, don't wait, vaccinate. That's an important thing to remember. And go to doctor when you do not need him, and you will never need him. That's another thing to understand.
Thank
Remember
you.
four I's: immunization, insurance, information, investigations. This is what is you have to have the take home message.
Thank you. Thank you so much, doctor. Another question is, doctor, somebody who had jaundice earlier, does he need hepatitis A vaccination? Do his family members also need vaccination?
Yes, both of them, they need hepatitis A vaccination. The ones who has had it again, and they should take it. Their family member should take it because it means probably it's in the water supply. Probably they have a surrounding where the hepatitis A possibility is high. So taking a vaccine, actually taking an extra dose of vaccine is also not harmful. So again, people get confused. Sir, I'm not sure whether I'm vaccinated or not vaccinated. If you're not sure, please take a one shot. At least one shot is needed. See, hepatitis B vaccine, we need to take every 5 years one shot. Okay, checking anti-HBs titers is more costly than the vaccine cost itself. So yes, so if you're not sure, sir, I have taken hepatitis A one shot 5 years back. Should I take it again or not? If you have a doubt, please take it. So please understand it. Extra dose of vaccine, of any vaccine. Now, please understand and do not give me that scary question. I'm at this time we are only talking about the non-COVID vaccines. See, COVID vaccines were approved for emergency use. We are talking about the traditional vaccines which are in the market for more than a couple of decades. So, if you are tempted to give me a bouncer by checking the COVID related question, probably I will not be happy taking that question. So, non COVID vaccine, any vaccine, if you're taking an extra dose, there is no harm. सर मैं आई एम नॉट श्योर कौन सी वैक्सीन दी थी 3 साल पहले वो लिवर की रिलेटेड वैक्सीन कोई दी थी से जॉन्डिस के लिए वैक्सीन दी थी आई एम नॉट श्योर इफ यू आर नॉट श्योर प्लीज टेक इट hepatitis A you can take it extra dose, hepatitis B vaccine you can take it extra dose. I hope you are able to understand what I'm trying to communicate. Over vaccination, the non-COVID vaccination has never ever created trouble as per our experience. My experience 20-25 years, but I'm talking about the experience of 50 to 70 years over what is given in the Bible of internal medicine, that is Harrison. I hope that communicates the right information. I don't want to give you confusing or wrong information. We all are discussing non-COVID vaccines, and hepatitis A, hepatitis B, HPV, shingles all fall on this. So
Thank you, doctor.
yeah.
The another question is, doctor, there is a belief that adults anyway would have exposure to hepatitis A in the past. So vaccination is not needed. Is it correct?
No, I will rather say it's wrong. You need to have a proof. Who will get the infection and who will reach ICU, we never know. If you have you're partially correct. If I'll say it, you can be safe already, and the only thing which will help you out is a IgG and IgM levels. And in that way, whenever, as I've told you, when in doubt, vaccinate is the dictum which you need to remember. And I'm not going to talk about the commercial call. I'm not making a commercial statement. I'm making a very responsible statement so that you understand it. Yes, definitely, it's been sponsored by Human Biological, but I'm talking about what is available in the forum, the intellectual forum. So please take it out. You definitely need it. If you have a doubt, take it. If you want to check it out, if you're very much keen on not taking the vaccine and still want to check your vaccine, your immunity level, please do the immunoglobulin levels. So if you have the IgG levels which are above the safe limits, then you don't need to worry. Then you can afford to say. But without knowing it, assuming, no, no. I assume because there will be a lot of viewers from Andhra, Telangana, the Telugu land places. The two-letter words which kills Telugu people is sir Ausarama or Nenu Anukunna. Ausarama means is it needed? Is what is the same question you are asking me. And Nenu Anukunna means I thought so. मैंने ऐसा सोचा. Sir, I will advise you. आप मत सोचिए and best thing is take the help of a doctor. वो आपके लिए सोचेगा, आपको safe रखेगा.
Thank you so much, doctor.
Thank you.
Uh, Another question is, doctor, if somebody is having liver infection, then when can the person be vaccinated? Meaning, after how many days after infection subsides, vaccination can be started?
Usually from 2 to 4 months we wait. Longer the better. See, जैसे कि देखिए, try to understand these few things. Um, if you have, if a baby is born, we have done enough studies. We give quite a lot of vaccines after 9 months, because 9 months the mother's immunity saves the child a lot. Okay, try to understand that way. So when you have got infection, you have antibodies which will save you for a longer time, for some time. Your body should be healthy to produce further immunoglobulins. So if you have an infection, active infection, and you're coming out of infection, I usually say 4 months to 6 months. अब जल्दीबाजी किस बात की है? See, अति का भला ना बरसना, अति की भली ना धूप, अति का भला ना बोलना, अति की भली ना चूप. Anything in excess is bad. Excess of knowledge is also bad. Do not try to jump in. Slow and steady wins the race. वेट करिए ना साहब, आपको हुआ इन्फेक्शन, डोंट हैव टू टेक द वैक्सीन इमीडिएटली. बाकी खानदान में दिला दीजिए, अपने माँ बाप को, बच्चों को, गर्लफ्रेंड को, वाइफ को, हर किसी को दिला दीजिए. इट्स नीडेड.
Thank you so much, doctor.
ये
Uh,
गर्लफ्रेंड मैंने इसलिए बोला क्योंकि काफी आंखों में चमक आ जाएगी, तो दैट इज ऑन द लाइटर नोट.
Thank you, doctor. The another question is, what is the dose and how many doses adults should take, and is booster vaccination hepatitis A needed?
2 doses is what we usually give, and sometimes there are more also, depending in terms of your clinical profile. But for an average Indian adult, we give 0.5 ml once. And if we take it as a today's dose, that is 18th of June, next dose falls after 6 months. So 6 plus 6 is 12. So I'll give it on 18th of December. Anytime after 2 months to 6 months, you can take a second dose. The farther, the better. As per our studies, the serological titers, we have realized 6 months of gap is better. So these gaps are extremely, scientifically evaluated and considered. Say, hepatitis B, we give 0.16. Okay, and for faster immunization we give 0.12 or 0.126. So these things are different, and correcting with your own doctor is better. But hepatitis A, a 0 dose, that is the first dose, and then the 6 months is the second dose, is what we usually suggest. 0.5 ml is the best one.
Thank you, sir. There's another question. He's asking, how can we increase awareness for adult vaccination in India?
By joining such kind of webinars and sharing the same video, because definitely we talked a lot about hepatitis A, but we did talk a lot about the general concept and the doubts to clarify over the adult vaccination. So adult vaccination immunization is very much important for all of us, especially for the responsible parents. And yes, I think sharing the video and right information is needed. You have any doubt, any one of you, I'm very happy. He would be very happy to extend a free consultation if you come to Apollo Hospitals or Ethan's Clinic or even Live Life Clinic, especially any consultation related to adult immunization and vaccination. You can quote, and I will ask my team to get back to you. Otherwise, text me at 8106127475. फॉर हमारे हिंदी भाषी लोगों के लिए 8106127475 पर. It's my personal number. It will be with my secretary, otherwise with me, and we will reply back to you. And I hope you will take advantage and share this information. Share if you care, is what I will ask you to do. That 2/3 of Indian adults do not know importance of adult vaccination. That's why our hospitals are full. So
Yes.
राइट इन्फॉर्मेशन आप शेयर करिए, हमको हेल्प करिए, हमारे साथ जुड़िए, जिससे कि हम अपने देश को, अपने समाज को एक सशक्त देश बना सकें. एंड यस, दैट्स व्हाट इज नीडेड आउट ऑफ यू.
Thank you so much, Doctor, for answering all the audience questions. And I want to thank you again. It was a very wonderful session, Doctor. And we wholeheartedly thank you, Doctor, on behalf of my team as well as the Human Biological Institute for sparing your valuable time with us. and and I know a lot of people who are watching us are benefited from this wonderful session. I wholeheartedly thank our viewers as well for being with us in each and every session. We request you all to please visit www.puberty2menopause.com for more information on various health aspects of women at different stages of life. Thank you so much, Doctor.
My take home message to everybody will be, if you've liked this session, do say hello to me, the number which I have shared, and let me know your honest feedback. You can give even a negative feedback also. We will try to improve on that. The number you got it, 8106127475. And second thing is, yes, don't wait, vaccinate. It's all about saving your family. So go ahead and take a hepatitis A vaccine. Have you sure? Stay happy, healthy, and smiling always. Thanks a lot, Deepali. You've been a great and great host. We really loved the session with you. Take care. God
Thank
bless.
you.
Goodbye. Namaskar.
Thank you so much, sir. Have a good day. Thank you. With that, I wish everyone a very good day. Thank you.